Today, we want to talk to you about a new study since you've been diagnosed with a brain tumor and may be receiving radiation therapy. Radiation treatment for a brain tumor is a highly personalized process. Your radiation plan will be created specifically for your anatomy by your radiation team, which is led by your radiation oncologist. However, we know that with radiation treatment, particularly when memory centers are near the tumor, there are risks of side effects like changes in memory or thinking. REFINE is a new study that is looking at frailty or overall health, and frailty is a measure that we get from specific questions and physical tests. This helps us see if we can understand which patients will get memory-related side effects from radiation treatment for a brain tumor. Frailty is a measure of vulnerability to stressors like cancer and cancer treatment. We know frailty makes patients more sensitive to memory-related side effects from chemotherapy or chemobrain, but this isn't known for radiation side effects. Our ultimate goal is to use frailty measures to make radiation therapy even more personalized. While this study will not change your radiation therapy plan, the information from this study will be used to design ways to personalize radiation to better support future patients to reduce their risk of side effects after radiation treatment. We will ask patients to participate in 4 visits over 1 year. We will try to time the visits to happen at the same time as standard provider visits to avoid any extra travel. The visits will involve asking questions about your medical history. There will also be tests of memory and thinking. To measure frailty, we will give participants surveys, and we will also do physical tests. This includes standing from a seated position, a balance test, and a walking test. The study will add an additional 10 to 15 minutes to MRI scans that are already being done. While the sequences can be done separately, we will combine them with standard MRIs to avoid any extra visits when possible. The frailty measurement requires some basic labs that many patients will already have. If participants don't have these already done, the study will pay for them. There is also optional blood work that will be used to look at mutations that change the immune system with frailty and age, and whether they're associated with memory and thinking side effects. But this is not required to be on the study. The assessments take time that could otherwise be spent doing other things. The blood work has the risk of bruising, pain, or infection. There is a slight risk of fall during the physical testing, but we will do our best to avoid that and have given our coordinators additional training to prevent this. There is slight risk of loss of confidentiality, but we will keep information on University of Washington servers and only allow access to the study team. All non-standard of care assessments are paid for by the study. We will pay for parking up to $10 during follow-up assessments and provide $15 for each visit to help cover expenses as much as possible. Your frailty assessment will be given to your primary provider so they can make any referrals needed to support you during your treatment. Thank you for listening to this video. This study will help to personalize radiation therapy by giving radiation oncologists better tools to see how frailty changes risk of side effects. We hope this has helped you understand the study, and let us know if you want to participate or have any questions.